What we will dive into next is a bit more basic and something that is always a little bit at the sides of tech conferences, even though it should be in the middle. We're talking about health, which often takes a second seat next to drones and other fancy tech stuff. And when we talk about health, it's mostly about healthy people having wearables, tracking their points, and so on. But health is a little bit more than that. It is actually sometimes about sick people and treating them effectively. And Dr. Thomas Rudolf will give us some insights today in how digitization can help us cure patients, how we can take the view of the patient into this equation. He's a principal at Oberender Partner and the prior head of business development for Sana Kliniken, which is a big, large private clinical enterprise here in Germany. We are happy to have him here. Please come on stage, Thomas. Welcome.
So, hello everybody. Thank you for staying so long. I'm pretty sure this is the party crowd for the after-show party later at Café Bangkok. I hope you're a little bit interested in healthcare. I was introduced. I'm a member of the executive board at Oberender Partner, a management consultant company based in Munich and Bayreuth, where we come from. We are a spin-off of the University of Bayreuth. We have a business unit for digital health. The reason is that we found out that our recommendations for healthcare providers, which are our clients, are better if we add recommendations from the digital health world. Thank you, Daniel, for the invitation. I don't want to forget this. We talked about the importance of digital health during some meetings in summer. The result is that I stand here, and that we will have another talk session in January, on January 16 here in Munich, about that topic. I hope I can show you some important aspects, because talking about digital health usually means filling a whole week. I have 20 minutes, and I hope we can discuss a little bit about the topics after my presentation. About 1 year ago, about 1 year ago, Apple had a keynote presentation in Cupertino with a slogan, "The only thing that changes is everything." And I'm really impressed by that slogan, because take this day today, 48 forward, we see so many things out of the digital world, so many innovations we can expect during the next years and decades, that this slogan is probably true, not only for Apple, but for almost every branch. The question is it also true in a highly and strictly regulated sector than the healthcare sector? I hope we can answer some of this question during or at the end of my presentation. But first of all, you saw this. Take a look back in the car industry and the early age of the automobile. If you look on the picture below, you see if you drove a car about 100 years ago, you had a lot of instruments around the driver. You have instruments for speed, for oil pressure, for fuel, etc., etc. But you had nothing that have shown you the direction, the way to your destination. Last week I picked up my new car, and it's the same model than the model I bought 3 years before. But it's a huge development in online services for the same car, only within 3 years. You have navigation services, you have traffic, current traffic information in real time. The car calculates your alternative routes, you have GPS, you have online services, you can download apps directly in your car. I think the car sector, the car industry is a very good example, maybe not the best one, but a very good example that can show what is possible with digital transformation. What can we expect in a new world, in a new digital world? The question is, what about healthcare? About 150 years ago, the main goals of healthcare providers, of doctors, of physicians, of hospitals, were not healing the patients, healing the people. The main goal was nursing the sick people, because you had not the possibilities to healing people for many diseases. Of course, since then we have a huge development in medicine, in medical quality, increasing medical quality, increasing life expectancy, so many other things you can imagine. But if you look behind that, you have to see that there is the same pattern during the whole time, during the decades and centuries. The patient goes to the doctor knows everything or almost everything about medicine, the patient knows nothing or almost nothing about medicine. So you had no chance to take influence in your medical treatment. And that changed with the upcoming internet and with the upcoming digital services during the last years, especially with smart devices like smartphones. Before we go into detail for healthcare, I want to mention this. This day today, and any other conference about digital transformation shows us that old rules doesn't matter. Take some examples from outside the healthcare sector. The old traditional rule, too big to fail, is not true any longer. Now look at Kodak, look at Neckermann, Quelle, Brockhaus in Germany, for example. That's not true any longer. And the other rule, too small to succeed, is also not true any longer. Look at Airbnb, look at Flixbus in Germany, for example. They understood the internet. That's the reason why they are the winner in the competition of the bus services. But that also means the old economy that we know from the last century or the last centuries doesn't exist anymore. We develop our societies, our industries towards an on-demand economy. And what's on-demand economy? I have the definition for you here. This is defined as an activity created by companies, by startups, by innovative companies that fulfill consumer demand immediately and directly. And why is this important for healthcare? Patients had, until the upcoming internet, had no chance to formulate their needs and to formulate their demand, because they didn't have the right information, the relevant medical information. Okay, they knew I have headache or I have something else, but they had no information about the right treatment. They depend on the doctors, on the hospital sectors, and that changed with digital transformation, and that's so important. That's the revolution in digital health or in healthcare through digital healthcare services. To answer the question, about sense, about new ways of digital transformation and about new ways to treat our diseases, we need to know where health comes from. This is the result of a study from the Surgeon General report in the USA. It says 50% from our health comes from our lifestyle, 20% comes from our environment, another 20% from DNA, and another 10% from the healthcare system. But that means nothing else than health happens in our everyday life. To pronounce this sentence correctly, I have to say our health happens in our everyday life. It depends on our behavior. It depends not in the main way from the physician or any others. It's our behavior that influences our health. I have some numbers for you to understand this a little bit better. 95% of all decisions about the adoption of medical services happen outside the healthcare system. That means it happens with the help of families, of colleagues, of friends, discussions, maybe online discussions. There's an interesting startup in the United States, smartpatients.com. It's founded by the former head of Google Health. That's a kind of Facebook for patients. where you can discuss about your health with other patients, not with physicians or doctors or other healthcare providers. Another number, 70% of all correct medical diagnoses depend on the quality of communication between the doctor and the patient. That means it depends not on the quality of the physician. That's very important because the success of a medical treatment depends on the way how you communicate with the doctor. And that means you need, as a patient, the right information, the relevant information. You need to know what is the relevant information the healthcare provider needs. That brings us to the other number. About 70% of all patients who take advantage of the healthcare system do not need medical help by physicians. That's very interesting. That is proof that proves that you go to a doctor, you go to a healthcare provider because you don't have the information you need. You're not sure what happens with you and your body, and so, okay, you go to a doctor. And the result of this is the other number. About 75% of all patients who take advantage of the healthcare system could help themselves if they have the right information about their health status and have the right information at the right time, we have to add. And the last number, very important, I think, 60% of all patients who really need help see a physician too late. What does that mean? That means that medical treatment needs longer time, is more expensive, and probably as a patient you have to suffer and you have to accept less quality of life during the time of the medical treatment. Sometimes it ends with a death. So take these numbers and keep it in mind. Let's sum up for a first time. It's not the end. It's a summarize of what I said before. So the focus is the patient. The patients are in the center of the medical system more than ever before if we introduce more digital advices, more digital tools. Health happens in our everyday life. We learned that our behavior decides about our health, but it's important that we as patients are well informed about medical treatment, are well informed about our body, our health, and then, if this is the fact, it's more successful, it's more purposeful, it's also probably more efficient, less expensive. But what does that mean really for the future of healthcare? Let's have a look on today. If you're really good, you go once or twice per year to a doctor for a checkup. So the doctor sees you, sees your body, analyzes your health, but that's an episodic checkup. Patients and doctors are unaware of our health status during the most time of the year. That's a fact. What happened are unexpected emergencies. So if we think what digital transformation can do, and we see this in other branches, think about the car industry, we should think about tomorrow for the healthcare systems. And what I see is more patient empowerment, or patient empowerment. That means we need to collect data, we use the data. I said big data rules. We have Josef Scheiber here for the panel discussion later. We will discuss about big data and all the problems and possibilities behind that. We as patients need to monitor, analyze our body, our health. We report the health data, maybe in real time if we want, to healthcare providers. We can discuss this information with the healthcare providers online. We have the medical information, we can use it. So we are empowered to self-monitor and interact with the healthcare system. We are no longer the consumers, no longer the patients that I described before, in the situation where we have to believe the doctor because we had no information. That's a great chance for us. What we need are only the tools that we use in everyday life for other needs. Smartphone, smartwatch maybe, tablet computers, internet. So it's nothing new in that sense of medical tech innovations. I have some examples for you. I named 4 categories here. Health companions are apps or services that enables you to collect your data, data, especially if you have chronic diseases. One Life, for example, they offer an online, offer online pregnancy record. I hope that's the right word in English. MSense is a fantastic app for migraine patients. You collect your data as a migraine patient, and behind the app there's an algorithm, and it calculates when you have your next attack and how intense this attack will be. Very successful startup in Berlin, based in one of the biggest healthcare incubators in Europe. We will have a closer look on Preventicus on the next page. Empera is a digital diabetes care app. Very interesting are the Doctors on Demand. Patientus is a German app that offers online consultation services for patients. Clara is something like WhatsApp. Probably the founders have another opinion, but that's a messenger platform for patients and doctors, so you can communicate and you can chat in real time with doctors. And so you can decide, have I go to a doctor, have I go to the hospital, or can I stay at home and can treat my disease for myself. The most interesting app is Dr. Ed. Dr. Ed is an online doctor with online consultations, with online treatments where it is possible. And they also offer you and they send you medical prescriptions. The funny thing, or better, the ridiculous thing is this is forbidden in Germany. The founders are German. They want to be active in the German market, but because of the laws in Germany, they had to move to London. Because of the freedom of services in the European Union, they are able to offer the service from London, so you can call them, you can write them, you can chat with them on video or on text. They chat with you and they decide online if you have to go to a doctor, if you have to go to a hospital, or send you a prescription. German startup based in London, probably in the next year, not in London, but in the Netherlands or anywhere else, because they need this rule of the European Union. The last category, digital treatment, digital therapy, are 2 examples. Caterna is an app who treats amblyopia, that's a deformity of children's eyes, and they found out that playing special online games treats this disease, and they offer that. It's paid by 2 of the biggest public health insurance in Germany. And my most favorite is Tinnitrax. I have no tinnitus, but they offer treating tinnitus with your favorite music. So really good thing, I think. So I promised you a closer look to Preventicus, because Preventicus shows what I said before on the more theoretical slides. Preventicus developed an app for smartphones that obtain health parameters without any extra tools. You only need your smartphone. The app measures your pulse with your smartphone camera. You have to put your finger on the camera. It's patient-driven. You need no doctors. It's developed to identify cardiac arrhythmias. It's developed to collect your data about your blood pressure, about your heart rate, and similar things. All the results, you see that in the last picture below, all that results are documented in a PDF report on your phone or in the cloud or wherever you want to collect the data. The data will be not transmitted to any healthcare provider or a health insurance if you don't want to do this. So it's up on your tablet or smartphone, and you can show it to the doctor if you have your next consultation in the doctor's ambulance. So the doctor can see what you did at home. That is what I mean. You are possible with digital tools to collect your own data, and Preventicus is one example out of many examples today that offers us this service. All apps of Preventicus are certified medical devices. That's important in Germany. Some academic research stands behind that. It's a real good measurement. Most doctors don't know that. They are really surprised how good that works if the patient shows that to them in the consultations. So that's to Preventicus. So to come to an end, maybe not in the short term, but in the midterm and long term, the only thing that changes in healthcare is everything. I think we can say this, because digital transformation brings us so much more possibilities we didn't know about over centuries before. I think this is really a great thing. That does not mean that we will not have hospitals and physicians in the future, but as I say here, no consultant can close a presentation without a final statement, so that's the reason for that slide. Digital health solutions provide a much more comprehensive and relevant picture of our health. That's the thing I want to say you at the end. The result is medical treatment is less expensive. With digital tools, it's more efficient, more personalized, and more precise. And the both aspects, the both personalized and more precise, is something we can discuss with Josef Scheiber. So I say thank you for this. I hope I was in time. I say thank you for your attention. You can follow us at Facebook, also on Twitter and Xing, but I think one address is enough for you. Thank you very much for your attention.